Hey there, it's Dr. Justin Marcagiani. Welcome back to the podcast. Evan Brand and I are in the house. We will be discussing on all topics B12. So let's dive in. Evan, how are we doing today, man?
Hey man, I'm doing pretty well. I'm excited to talk with you about something that is so common, yet so overlooked by conventional medicine, but it could change your freaking life. And it's B12 deficiency, which is a problem that I have and I had previously. And I think it was all stemming from my gut infections. I believe it was because I had H-Pylori, which reduced my stomach acid. Therefore, even though I was eating grass-fed beef, I still wasn't getting the B12 from my meats, and therefore I was low. And I had definitely some nausea. I definitely had some digestive issues, fatigue. It showed up on my testing too. So B12 is huge, even for somebody like me who thought they were doing it right.
Yeah, B12 is really important. A couple of things off the bat, just to kind of highlight, B12 is really important for methylation. So methyl groups are a carbon and essentially three hydrogens, and we methylate neurotransmitters, detoxification pathways. We activate various genes through methylation. So B12, and I would say B12 tends to work really well with its sibling, folate. Folic acid's kind of let's just say one of the more slang, not so good qualities or not so good types of folic acid or folate. Folic acid has to get converted to folate, and a good chunk of the population, 70%, are at least heterozygous, meaning they're missing one gene to help basically convert that folic acid to folate via this enzyme called MTHFR, methyl tetrahydrofolate reductase. So essentially B12 is really important, and it uses folate, activated folate, along with it for methylation and gene activation.
Yeah, and a lot of people talk about MTHFR. They're not really sure what's going on. You're at a reduced capacity than other people to work this conversion process. So that can result in fatigue. And the question may be, well, does that mean I go straight on a methylfolate supplement? The answer is not always, because some people don't feel well with those. So there's a Goldilocks that Justin and I have figured out with people. Sometimes you can go too high, sometimes you go too low. So there's always a tweak with this. So on this podcast, we're not going to say, hey, your magic dose of B12 and folate is going to be X milligrams or X micrograms per day, because you got to figure it out. There's just not a number.
And there's a couple different types of B12 that's out there. You have your conventional cyanocobalamin, right? Cobalamin is the B12, and it's bound to a basically almost like a cyanide type of molecule, right? And then you have the more bioavailable types. You have the methyl B12, which it's methylated, it's bound to a methyl group. Then you have the hydroxyl group. The hydroxyl group is bound to a hydroxyl, and then you have the adenosyl group. Hydroxyl is going to be, I think that's going to be a lot more mitochondrial based, and then B12 can help on the methyl side, will help more with detoxification, and will help more with the methyl donor side. So detox on one side, and then on the hydroxyl side will help more with the mitochondria and help with nitric oxide, which is really important for mitochondrial function.
I've had a lot of people actually react pretty poorly to doing supplemental methylcobalamin B12, myself included. I don't feel well on methyl. So I end up doing usually a combination of the hydroxycobalamin and or the
Yep. And I think
adenocobalamin.
some of that is from the detoxification, like we were alluding to. I think some of that could have a detoxification effect, and then going more with the adenosyl or hydroxyl or a combination of those two can help with the mitochondria a little bit more, help with energy, help with nitric oxide. I know you had, with some of the stress issues, you had more blood pressure issues. So of course, nitric oxide's a vasodilator. It opens things up.
Yep. So we've got some symptoms. Now we can test this. We'll talk about testing towards the end. If you have too little vitamin B12 in your system, what may happen? Could be poor vision, weakness, tingling in your hands and feet, clumsiness, fatigue, nausea, mental confusion, anemia, digestive issues, skin infections, nerve problems. And so Linus Pauling Institute, they've got their own opinion of major problems that could be linked to B12 deficiency, like breast cancer, depression, osteoporosis, thyroid issues, gastric cancers, neural tube defects, chronic stomach inflammation. So this is pretty nuts. And they've got quite a lot of literature on this too. So it makes sense.
Yeah, it's a biggie. So let's kind of dive in first. How does B12 deficiency happen? So number one, it can happen if you're a vegan or vegetarian and you're not getting let's just say any animal products. Even plant-based products, a good vegan or vegetarian is going to have to supplement B12. You're just not going to get enough in plant-based products. You're going to get it in egg yolks, and you get it in meat and animal products. So being vegan or vegetarian is one risk factor. Risk factor number 2 is you have poor malabsorption. You have gut issues, absorption issues, whether it's an irritable bowel disease or Crohn's, ulcerative colitis type of thing, or even just poor digestion. Because remember, the intrinsic factor is produced in the stomach, and it's produced by the parietal cells, the same cells that make hydrochloric acid. And this intrinsic factor basically tags B12. It grabs onto it, and then from the stomach, it goes into the small intestine. The duodenum is the first part, the jejunum, and then the ileum, it is then released and then reabsorbed back up in the ileum. So it's like you have this carrier, this tag, or this relay race where intrinsic factor binds to that B12 in the stomach and then releases it back down at the very end of the small intestine in the ileum. So it's really important because if we have gut inflammation, and let's say we have poor parietal cell function, which tends to mean we also may have low stomach acid, that poor digestion is going to create more leaky gut, more gut inflammation, and continue to decrease intrinsic factor. So if we have low intrinsic factor, or if we have intrinsic factor antibodies, or parietal cell antibodies, this is called pernicious anemia, where we have an autoimmune attack that's attacking either the cell or the compound that's produced to help basically run that relay race for the B12. So the more you have leaky gut, the more you have gut inflammation, there's a greater chance of autoimmunity, which could affect B12 absorption. And for those kind of people, we tend to go more on the sublingual side with intrinsic factor. And we may even do the adenosyl hydroxyl version to go sublingual, bypass the gut. And we may also even opt for an injection.
Great point. Yeah, people were going to ask, well, why can't I just take a supplement, swallow a pill for this? Well, you just alluded to the gut infections or other problems, inflammation, autoimmune gut conditions, that may reduce the absorption. So just because it says on the label, you're going to get X amount, that, we always say, oh, you are what you eat, but not necessarily. You really are what you digest. So if your digestion's compromised, then you're not going to get what's on the bottle, and therefore you might not get the clinical improvement you're looking for. Now, I just sent you a link to a PubMed study here. They call it Impact of Helicobacter pylori on the Development of B12 Deficiency. And long story short, the findings prove strong evidence H. pylori infection is associated with cobalamin deficiency. So that probably started it all for me. My diet wasn't great as a kid, but me having that H. pylori infection, that was probably a huge trigger for my B12 to be so low.
Exactly. Yep. Totally makes sense. So this is why it's so important that if you have B12 issues, you have to make sure the diet is right. The diet's going to be super important. Vegan, vegetarians are maybe going to have a problem. The next is if there's a leaky gut or any inflammation in the gut, that has to be rectified and addressed. Now, in my line, we use like methylated B12 and methylated B vitamins because typically you want to take it with B6 and folate and B12. But some people, they may need to go sublingual. So we may want to go in adenosyl hydroxyl form, which gets absorbed more in the mitochondria versus the plasma for the methyl B12. So very important. We got to get to the root cause. So what are some great food sources or anything else you want to highlight before we go into the food component, Evan?
Well, I wanted to get your opinion on the whole B12 shot thing. I mean, you and I work with so many people, and we hear every single week someone going into a naturopathic clinic or some other clinic to go get a B12 shot, yet we run their testing and they still look low in B12. So what are your thoughts on B12 shots?
I think for some people, it may make sense to do it, especially with severe malabsorption and severe gut issues. I think for most people, just a sublingual or just a capsulated B12 with other methylated Bs like the L-MTHFR folate and pyridoxal or 5-phosphate or good quality, pyridoxine HCl, B123, that's going to be enough for most. Some may have to go one step up and go to a sublingual and an adenosyl or hydroxyl form. For most, that's going to be enough. If there's severe issues, maybe an injection in the beginning. Like if we have an ulcerative colitis or Crohn's issue, we have blood in the stool, maybe to that degree, that makes more sense in the beginning. But in general, I work with dozens of IBD patients, and we typically are able to get their colon and their digestion stable and the inflammation down where that stops. And then we're able to get their levels up with just sublingual.
Yep. Yeah. That's my whole point too. I really don't want to go get a shot. The sublingual works so good. So yeah, I mean, here's the thing with the B12. You know, even if you do take more than you need, it's more of a people having problem with deficiency. Because if you take excess, your excess B12 gets stored in your liver. So even if you do take more than you need, that's fine. We're more concerned about you having too little, you know, rather than too much. And then you mentioned the food. So yeah, let's get into that. I mean, organ meats are going to be number one. So I've seen a lot of companies out there now where people don't want to eat organ meat. So these companies will take like a grass-fed liver or a grass-fed kidney of a cow or a lamb, and then they'll put that into capsules. So you can take like liver pills, you can take kidney pills if you want. I personally don't do that. Maybe when I get more into hunting, I will eat, eat the deer or eat the other animal's liver. But currently, me personally, I do not do liver.
Yeah, exactly. So, I mean, I think it's a great source to do it. A lot of my women that are cycling and menstruate heavily, I'll have them do liver during that time frame just to get some extra B12 and store it up in their liver. Even just an ounce or two per day during that time is enough. There's a lot of B12 and or iron in the liver. So a couple of things I want to highlight. So we need B12, one, to help develop our nervous system. So early on, we can have neural tube defects, which is basically our nervous system doesn't close all the way up. And essentially, we could have it on the backside where we have spina bifida, or we could have it on the front side where maybe we have a cleft palate, right? Those are all B12 or neural tube defects issues. Next, we may see macrocytic anemias, right? Megaloblastic macrocytic anemias where our red blood cells are really big. So red blood cells, unlike us, we start off small and get bigger, right? Red blood cells actually are bigger and then get more smaller as they mature and get older. And we need healthy levels of B12 and folate and methylated B vitamins to help this conversion happen. If not, we'll run an RBC or a CBC, I should say, complete blood count with indices. So we'll run like MCH, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, mean corpuscular volume, MCH, MCHC, MCV. These are markers to look at how big the red blood cell is. And if we see a really big red blood cell, that can give us a big sign that we don't have enough of those B vitamins on board, especially if we start to see low RBC, low hematocrit, low hemoglobin. That tells us we got some B vitamin issues.
You know what I found this to be true in is women, or I mean men too, who do too much alcohol. You know, I've looked at some of the literature on how alcohol can damage your liver and as well as your red blood cells. So when you look at some of these, like, not let's freak out level, but when you look at some of these low red blood cell levels, it could be linked to, you know, a woman doing 2-3 glasses of wine every night. And all we don't even have to supplement. In that case, we'll just say, hey, pull out the alcohol for a month. And then if we get blood looked at again, now all of a sudden the red blood cell count looks normal. You and I have talked about this book before, but I love it. Dr. Dick and Weatherby's book, CBC and blood chemistry analysis. He's got some really good functional markers in there for like your red blood cells and white blood cells and all that. So that's a good resource for people if they want to look at their blood work and see, you know, how do I stack up compared to a functional range, which is tighter than conventional range. That's a good book for that.
100%. Yeah, 100%. So a couple of ways to test, like I mentioned, right? You can do the MCV, MCH, MCHC, which is, you know, it's going to be good. It'll give you a good indication. We can also run a serum B12. And if you're a vegan vegetarian, that could be really good. That could be a good marker. You may have, let's just say, enough B12 in your blood, but not enough in your cell. So this is where we like to look at methylmalonic acid or trans-holocobalamin. So if we have adequate levels of B12, we convert methylmalonic acid into succinic acid. So there's this conversion, right? And then if methylmalonic acid goes high, it's because it's not able to convert it into succinic acid. And then we can make that inference that there's not enough B12 to make that conversion happen. Does that make sense?
Yeah, it does. So you're saying with blood might not always show the true picture, correct?
It may not always show it. I mean, with serum B12, you may have, you know, it may show an okay amount, but we may still have issues. We have to run that organic acid test that we always talk about. And then on that test, we'll look at 4-aminoglutamate, which will give us a folate marker. We'll look at methylmalonic acid, which will give us a B12 marker. And we may also look at xanthiuronate and kinourinate, which will give us markers into B6. So we like to look at those key methylating nutrients, B6, B12, and folate together.
Yeah, this is on, I think you said it already, but just to be clear what this test is, this is a urine test. It's a first morning's urine sample.
Correct.
We run it on everyone. It's an organic acids test. And often what I'm doing now is I'm having that organic acid test combined with a chemical profile or even a mold test, which is a mycotox panel. So we can take one urine sample, run it through multiple machinery at the lab, and then we get multiple readouts, which is pretty cool. That way you are not just guessing on why this is happening.
Yes, and I had a podcast with Tim Jackson just last Friday, and he talked about the idea that lithium helps with B12 transport. And Dr. Amy Yasko talks about this too. So lithium orotate, not lithium carbonate, the drug, lithium orotate can really help with B12 transport. So that could be something, if we're having issues with B12, we may want to look at adding, 5 or 10 milligrams of lithium orotate with that as well.
Yeah, I was going to say it'd probably be a low dose, right? Just to get that effect going. And then lithium too, that's also used for a lot of brain issues, right? A lot of like depression and.
Yeah, you can see that help with depression, mood, anxiety issues. And we're not talking lithium carbonate, which is commonly used for bipolar, right? We're talking lithium orotate, the nutrient.
Wow, I've heard of lithium orotate being really calming for people.
Yep.
I wonder if that's because it's helping to transport the B12, as you're mentioning. Maybe that's why it has the effect that it does. It has multiple mechanisms.
100%. Yep. And there's some studies on it, some studies showing that it's connected with lithium, with B12 transport. So I think it's, it's another tool that we'll put in our tool belt, so to speak.
Well, let's get back to food just for a couple minutes, and then we got to wrap up. So, we talked about the liver. So beef is going to be good, especially your pastured animals, your grass-fed beef. You could do your elk, your bison, whatever type of meat you like. Eggs are going to be great if you can tolerate them. Good pastured eggs, happy chickens that roam the grass and ate bugs like they're supposed to. Clams, I personally don't eat clams, but that was on a huge list of, hey, here's all these B12 foods. Clams was up there. There was another one, dairy, but I personally don't do much dairy except for butter. Would you say there's some B12 and some good grass-fed butter? Probably is.
I think so. I think you're going to get some of it just through the fermentation of a lot of the grass in the gut, right? The cow is going to basically ruminate a lot of that good, healthy butyric acid out. And I think you will get some B12 out of that as well.
Okay. And then, so we talked about blood, talked about urine, talked about supplementation, talked about foods. What are the mechanisms? What does B12 cause if it's low? I think we hit on every point, unless you want to bring up a couple others. Yeah.
So kind of going back, we talked about neural tube defects. If you have low B12, that's kind of more on the pathological side. And of course that starts early on. So of course, if you're a woman, you're looking to get pregnant, you should be on a really good, your multi should automatically have folate in there, not folic acid, and it should have at least good methylated B12 if you're not having any problems. And then we should be eating our leafy green vegetables. We should be getting egg yolks. We should be getting grass-fed, high-quality meat, and maybe even a little bit of liver, especially if, as a woman, if you're having your period, you're going to be losing blood. So getting that liver will help with extra iron as well, and then some good B12, which you'll store it up in your liver. So that's a really good starting point to prevent a lot of this. And then number two, on the back end, we can have what's called subacute combined systems disease or posterior lateral sclerosis, because we need healthy levels of B12 to build our myelin, to build our nervous system up. So it's really important that we have enough B12 for those issues. I already talked about B12 and the gut and how that can be a sign of pernicious anemia or other IBD or irritable bowel issues, or just a lot of gut inflammation and extreme malabsorption in the gut. So I think these are all really important things. And then I would say, of course, you're going to see thyroid issues, right? If we have inadequate levels of B12 because we don't have enough mature red blood cells. Mature red blood cells carry nutrition, carry oxygen, and we need that for healthy metabolism. So we could have lower thyroid function as well. We need B12s to be able to methylate. So when we do drugs like the methotrexate chemotherapy drugs for, let's say, massive gut issues, a lot of these, they treat these irritable bowel diseases with typically corticosteroids and chemotherapy on the gut, methotrexate, that inhibits a lot of B12 and folate, and that can create more DNA damage. So we need adequate levels of B12 to really have good, healthy DNA repair. And that's really important, and activation.
Yeah, well, just to mention too, on the drug front, think of all the people on acid blocking medications, whether prescribed by their GI doctor, the regular doctor, or even just the over-the-counter Zantac, Prilosec, any of these proton pump inhibitors. Those are all going to be reducing your ability to digest and absorb B12. So even if you eat a paleo diet, but you're on acid blocking medications, or you have infections like we test for, parasites, bacterial overgrowth, candida, H-Pylori infections, anything that's disturbing that gut balance and that is stealing the nutrients from you, you could have low B12 there. So always make sure you're working towards that root cause. Don't just take the pill. of B12, get a good quality, as we mentioned, but make sure you figure out why. Why did this happen in the first place? Always ask why. Make sure you get there with a practitioner. So I know Justin and I got to wrap up. So if you want to say a couple comments.
Yeah. Also, if you have, let's say, an elderly parent or grandparent, some dementia and Alzheimer's like symptoms can come from low B12. So if you know anyone in your family who's older and has these issues, this is where I think it's really great to bring in, hey, let's get them a good quality B12 injection. Let's get some nutrients, because sometimes that can be turned around with simple, high quality injectable methylated or, adenosyl hydroxyl B12 can be super helpful. There's been some studies on Alzheimer's dementia patients where, I think it was 10% saw a massive improvement in their memory with the B12 injection. And I'd also say, look for the canker sores. Canker sores are a big sign that you could have a B12 issue. Also, it's a big sign of gluten sensitivity, right? These are aphthous ulcers. So that's another big thing I would say to look at. And I think the B12 injections are a really big one. You already mentioned the foods, the eggs, the venison, the beef, the liver, some of the seafood. I think we hit all the major things, Evan. So I would just say, if you guys enjoy this great info, give us a thumbs up. We're clinically applying this information with patients every day, so it's not theoretical for us. We're in the trenches applying it. So I'm hoping that listeners here can use it to make their health better. If you like it, give us a thumbs up, give us a share. Let us know your comments below. We appreciate it. And we appreciate you guys supporting the podcast. You guys have a phenomenal day. Evan, great chatting, man.
Yeah, take care. If people want to reach out to you, justinhealth.com. You can schedule consults around the world. If you want to reach out to me, evanbrand.com. We look forward to helping you. Take care in the meantime.
Awesome, Evan. You take care, man. Thanks so much. Bye, everyone.
Bye.